argue was
Okay.
because shoot.
Well, we go to the back.
Otherwise, the atmosphere has a lot more CO2. No, but the CO2, because remember, your blood gas, it's going to change around. Your CO2 is going to change around in there to keep your pH, keep your pH normal. And so we tend to like CO2 that we're exhaling actually tends to be less.
Plus, if it's like embolization or something, it'll be
The thing is, like, things can affect it to change it around. So the thing is, like, so when we look at the monitor, we see a CO2.
Make sure this light goes off.
What are your initial settings?
Initial settings, 610 for 5 minutes.
So,
pressure 6.
We're trying to.
No, pressure 10.
And
then frequency.
What's going on in the arteries.
So what you're saying is this reading
So lights off.
could be
So we're going to push this and start it.
to the low.
Are you ready?
Yep. Because the exhale CO2 is different
We're going to do this for 5 minutes. And then we ask him to do a huff cough. Can you do a huff cough? And we do about a couple of them. Then we'd increase the frequency to 8.
To see if there's like a.
Are you ready?
Well, that's if you have something.
And then do this for 5 minutes. Then we ask him to do another huff cough. And then we increase the frequency to 10. Are you ready?
Yeah, I'm ready.
Do this for 5 minutes again.
Oh, yeah.
Then we ask him to do another huff cough. And then now we're going to do the pressure 6. And then the frequency 16.
Do the chicken cough with
Are you ready?
Yes.
Do it for 5 minutes. And then we ask him to do a huff cough. And then we change the frequency to 18.
That's funny, because I had a patient tell me the
Leave the pressure control the same. Are you ready?
I'm ready.
I had no idea what they were talking about. I'm like, whatever you feel like doing, okay, yeah, fine.
And then that one's for 5 minutes, and ask him to do a huff cough.
Gives more momentum, I think.
Or just get,
You get some music.
Yeah.
And then we increase the frequency to 20.
I think this fist therapy isn't working on you, Don.
Are you ready?
I think I have wheezes. Go ahead.
Okay.
Because we didn't give a rock with that later.
That's real good. That's the best setting.
Yeah, 5 minutes, and huff cough.
So, patients that have a